Start sharing. Start. Yes.
Okay. So as you know that 9 weeks of age, the fetus can even hiccup and react to loud noise if they can. So by 12 weeks, we'll mark the end of the first trimester. As I have told earlier, this pregnancy is divided into 3 trimesters, the first, second, and third. First trimester is the first, third, 3 months. Okay.
Can they hear us? How can they hear us?
They can hear, but they're not responding much because they have small, everything developed a little.
Okay.
Okay. Can you move to the next slide? This is the end of first trimester. That is the 12th week a baby looks like. So you can see a very small ear and all, right? It's just form. You can see the tiny hands, the leg, everything. And the structure that is prolonging from is this umbilical cord.
Yes.
Okay. By 12th week, this is the pic of a baby. This is a representation of a baby. So next one. So we'll move on to the second trimester. So again, we'll be calling until birth, we'll be calling this as a fetus. And the fetus, it continued to grow and change. It keeps on growing. And by the 4th month, it continues to be very active. That means by 4th month, it means almost around 16, more than 16 weeks. It will reach more than 16 weeks. At that time, you'll just come to know that between 16 to 25 weeks, it will get varied in different pregnant women. We'll hear the first movement of the baby. And the first movement of the baby is known as quickening. Okay, I have not mentioned it in the slide. It's known as the quickening that you feel. The first movement that you feel of the baby is known as quickening.
Quickening. Okay.
Okay, you can move to the next slide. This is the extra points for us. This is not that relevant. Okay. By the end of second trimester, you can see, and this is happening like in the 5th month, as you have said earlier, that you will have the anomaly scan. That means the scan is taken and we'll get to know if there is any abnormalities in any of the organs or anything that you have seen. A complete scan will be taken if the baby is having any kind of anomalies. And each and every part of the baby will be scanned and they'll say that. And by 5th month, we'll get to know out of India, we'll get to know we'll get to know the gender of the baby.
Gender is.
Yeah, it's possible only out of India. In India, it's illegal. Okay, now we'll move on to the next one. And the point, can I move to this? Yeah. So from between the weeks of 22 to 26, that means we have moved into the 3rd trimester. In this time, the age of the viability, that means the baby can survive if it's outside giving proper, like if we keep it inside incubator and all, the baby can survive if it happens. That means if a preterm pregnancy happens, the baby can survive if proper conditions are arranged. Okay. And between the 30 and 40 weeks, the fetus shows rhythmic alternation between, that means sleep, wakefulness, everything. That means it's later things. Just and can you move to the next slide? So by the end of the third trimester, that is, it keeps on moving. And as I've already told, the organs are fully developed. Everything is fully developed. And after the 37 weeks, that is known as the complete term. Okay. The baby itself has completely grown, and we have done all the relevant scans, everything, and we came to know that the baby is completely safe. And this is how by the end of third trimester, that is after 9 months, it will it will be in this position. That means head should always be towards the down. If the head is above, that means above this abdomen, if it comes just opposite, it is known as a breech position. And that requires a C-section in most cases.
Okay.
Okay?
Okay.
Because if, as you all know, that is the first thing that comes out. But if in case, if it goes opposite, that means in the breech position, and it is also known as breech presentation, where the head comes opposite side, the arms or legs are the first thing that comes out, and there can be complications. That means it can there can be any abnormalities in the leg or shoulder or something while pulling out. So it's always better to choose C-section if there is any complication. And C-section is not a very big thing. And it's a very good, what I believe is that always the mother and the baby should be in the safe side. Okay. This is the 39th week. And next slide. So this is just the highlights of the prenatal development. If you want, I'll just send this. Whatever I said, I have just represented inside a table form. If you want, I'll just send it. I'm not going to repeat. Yeah, we just move on to the next slides. Yeah, this is what happened in each weeks. Okay, this nothing more than what I said. Just everything that.
Okay.
Yeah. Okay. Now, this is the important thing that you told me to present in front of you. That is the environmental factors that influence on the prenatal development. Okay. During prenatal development, the environmental factors can significantly, that is for sure that if the baby is inside, then these environmental factors can affect their developing baby. Okay. So the first cause is the teratogens. This teratogens is any substance or any foreign substance outside the womb of the mother that can cause an abnormality in the growing fetus. So it can be a medicine, or it can be any kind of chemicals, or whatever it is. That is what we call teratogens. That causes an abnormality to the growing fetus. Okay. That goes during, okay, next slide. Next one.
Are antibiotics also?
Yeah, in some,
antibiotics also
yeah.
falls in that category, ma'am?
It's not all antibiotics. It's some antibiotics, not only antibiotics, many medicines are teratogenic to the pregnant woman in some cases. Okay. Okay. Is this the first slide after that one?
Yes, ma'am. There was.
Okay. It's previous slide. So a teratogen, it affects largely during critical periods. That means, as I told, critical period is considered to be the first trimester. That means first 3 months. And that time it is more vulnerable because it is in the embryonic stage. It has not developed. After 8th week only we can say that it is a fetus. So first 2 months, ideally first 2 months, it is the critical period. And that time, if any of the teratogenic, sometimes it happens, what happens is that it leads to miscarriage. So at that time, each organ system, it is developing. As I have told earlier, embryo, that 3 phases, I think you remember. Ectoderm, endoderm, gets,
Yes, ma'am.
and that is the period when it is called the critical period.
Mm.
And so we can also say that after 20 to 40 days after the conception, it's the most vulnerable period. If we
Mm.
get exposed to any of the teratogens, there is a chance of miscarriage. Okay.
Okay.
So during fetal stage, these effects are seen only on systems that are still maturing. So it will affect any of the systems that is growing. And it can be a brain or it can be genitals. Okay.
Mm.
Next. So next one is, okay, each teratogen exerts, so specific patterns of developmental deviation are seen in individual teratogens. That means I've told you earlier, everything, every teratogens is different.
Mm.
So if you heard of rubella vaccine?
Yeah.
So yeah, rubella is something that affects during the pregnancy time, and it can
Mm.
affect the fetus heart, eyes, and brain. So
Mm.
this nowadays rubella vaccine, I think in some countries it is given during the pregnancy. We'll get that vaccine before that.
Mhm.
And I think in India, as I've studied, I think the girls are given by the age of 12 to 18 or something. This rubella vaccine is given because once they get into that reproductive phase, there is less chance of getting this rubella.
Okay.
So it won't affect the baby.
Mhm.
Okay. Then there is a drug known as thalidomide that if we take that, it may affect the limbs of the baby.
Mm.
And other things are, okay, the effect of one teratogen may affect, okay, nutritional deficiency may intensify adverse effects of drugs. Okay, that means if nutritional deficiencies can affect, if the drugs that we take
Mm.
can affect the nutrition that is given to the babies. There may
Okay.
cause, some drugs may cause nutritional deficiency to the baby, the growing baby. Okay.
Okay. Okay.
Slide. Okay. And in some conditions, these teratogens may affect the fetus only and not the mother.
Oh.
Okay. And a particular teratogen may produce several defects, whereas several different may produce the same. That means sometimes one particular teratogen can produce many kind of defects.
Mm.
Okay. But in several different teratogens, okay, there are many different kind of teratogens that causing same effect in a baby. So all
Okay.
teratogens are completely different and their
Mm.
actions are also very different.
Mm.
I know these areas will get very much confused, so don't go so deep into it because the time when we studied, these were like very, very boring time also. Okay. Next slide. I'm not going deep into it. So just understand that there are many teratogens. Okay.
I was
So
very much afraid to have and cold, and when I was suffering from severe cough, ma'am, in my pregnancy time, and maybe I was in my 5th or 6th month, but I was not going to the doctor thinking that I'll be given some medicine or all. But the cough was not going, and with the big tummy, it was difficult for me to
yeah,
manage.
that is what is
Then,
happening. What happens is that especially in Kerala, especially in India, what we get is like we'll have many kind of home remedies. Even if it's Ayurveda, there are teratogens,
okay.
but we don't get to know about it much.
Mm. Right.
We'll think that I'm not promoting allopathy or English medicine, but what I say is that there are many things that get affected to the baby. So before ingesting any of those things, we should be aware of what we are taking inside. Mostly what we feel is that if we take Ayurveda, it is completely side effect free. But for babies, we don't think that everything is safe.
Right.
Especially if we have elder people in our home, we'll get some kind of things like that.
Right. Yeah.
So the legal and illegal drugs, next one is the legal and illegal drugs that can affect the baby, okay? So variety of drugs. I don't know if any one of you are having any stroke patients or heart failure patients. If you have, you might have heard of the word aspirin in your home. Aspirin is a drug that can cause. Yeah, so this aspirin, it has got adverse effect on the fetus, okay? That is one drug. And what happens is that if the patient heavily use the aspirin, the baby weight will be low. That means it will be a low birth weight baby. He or she will be having a lower IQ. Okay. And motor control, that means the muscle movements and all will be very low. So then the other thing is that non-alcoholic beverages that we use. That means all kind of soft drinks. Such things can be potentially a harmful thing. Okay. And the most important thing is that if you're a coffee lover, can you move to the previous slide? Yeah. If you're a coffee lover, the studies have found that means if you are drinking more than 3 or more cups of coffee a day, there is a chance of miscarriage. Okay. Especially, as I've told you, during the critical period. That means first 2 months, the embryonic phase. Yeah. Okay. Okay, next slide. So next is the nicotine and alcohol. If you have any people smoking or drinking at your home, you know that nicotine in smoking. We have found that both smoking and drinking are associated with disturbances in placental functioning. That means what is placental functioning? Through the umbilical cord, the baby gets nutrition and the oxygen. But if there is some disturbance in that, what leads is that there will be an oxygen deprivation. That means the baby won't get enough oxygen. And thus to potential structural and functional changes. That means baby won't get enough oxygen to the brain, and there will be many problems with the baby. So it is a very important thing that pregnant women should always move from smoking and drinking people, especially smoking, because we are just inhaling the smoke. Then there is another condition called sudden infant death syndrome. This is happening after birth. That means before 12 months. That means before 1 year. There will be they'll stop breathing and die without, there won't be any apparent cause. That means we will not find any cause if the baby dies before that. And it is more common in offspring of mothers who smoke, drink, or take narcotic drugs. So this is a rare condition in Kerala, but I just told you what it happens. So in Western countries, this is a common thing, but even in Ernakulam, in Kochi and all, it's very normal. In Kerala, like smoking, drinking, or taking in narcotic drugs, everything is common. If a baby born to those mother die without any cause, it's mainly because of this condition, and this is known as sudden infant death syndrome. We won't find any cause. What happened? It will be all of a sudden. Okay, next one. Okay, again, the smoking, I'm not, okay. I indicated passive smoke, low birth weight baby, everything. Okay, and there is also an increased, the passive smoke can cause intellectual and behavioral developmental delays. So if the mother is smoking, what happens is that there will be intellectual or behavioral developmental delays. Once the baby is born, there will be such kind of delays that you can find. It all happens when the baby is mother is pregnant. Okay. Due to the disturbances in the placental, as I've told earlier, the oxygen deprivation that happens in the brain. Later, when the baby is born, such kind of developmental delays can be found. And there is increased risk of illness such as pneumonia, bronchitis, laryngitis. Okay. If our husband or someone is smoking in front of us, if we are pregnant, there is a chance like pneumonia. We can have pneumonia during pregnancy. Any lung infections, like any ear infections, throat infections, any kind of infections, which is not good during that period. Okay, next slide. And finally, alcohol. This is what happens if the child develops into a fetal alcoholic syndrome once the child is born. As you can see, the feature of what is features of a baby after born, they'll have small eye openings and thin upper lip. These are all conditions of a fetal alcoholic syndrome. Okay. Just this is not that important for you. That is why I'm just moving it. See, this is what is said. Movements may be suppressed. Young infants, that means motor, the movements will be very less. This all happens after. That means initially it happens inside the womb, but later after birth, these are the things that they show.
These symptoms will not be getting when we are doing the scannings and will not understand, right? These kind of
So
symptoms.
we won't understand. We won't understand that time. They'll have a wide range of abnormal behavior. Okay, next slide. Fetal alcoholic syndrome, just remember about that. Many infants born to alcoholic mothers show withdrawal from the drug. And they show, this is not important. This thing is important, like they'll have low IQ born to a mother. Okay. And the test scores, when we put a IQ test score, they'll be very low grade. And they have they'll have more problems with attention and academic achievements. But this is, as I told, this is all rare conditions. That is alcoholic mother's condition. Okay. Okay. Next one. Next is the, we have gone through drugs, we have gone through alcohol, we have gone through smoking, everything. And this is finally the thing that is radiation. You might have heard pregnant women taking X-ray is not good because radiations can come.
Restrictions are there. Pregnant woman should not enter.
Yeah. So lead, mercury, herbicides, if we get exposed to any of these things like pesticides, the cleaning substances that we use to clean our house, food additives, and even if cosmetics are sometimes teratogenic to the baby, some kind of cosmetics. Okay.
These are the common things.
Yeah, these are the most common things that you have to get to know.
Oh.
Then what happens is that if we expose to lead or something like that, prematurity, low birth weight, brain damage, physical defects, as I've told earlier, there will be intellectual function and IQ will be very less. Okay. Okay, and certain pesticides can even be carried on for generations. That means if I am pregnant, if I pass it on to my baby, when next and then generations, this pesticide abnormalities can move on. That is what studies say. Okay. Now the next slide. Okay, the other thing, this is a very common example that you have all seen, endosulfan, which happened in Kasaragod district. So what happened is that through helicopters, they sprayed the pesticide in its plantations. This happened long back. And from 1978 to 2001, they kept on spraying. And this is the example that I've told earlier, that pesticides can move through generations. That means children born with neurobehavioral disorders, malformations, and other abnormalities. So when they took the survey, they found that there is incidence of bone deformities and infertility, mental retardation, congenital heart disease, and such things. Now, next one. Next. Yeah, this is the pic. I think you have seen this endosulfan cases. Yeah, with bigger head. Okay. Yeah, no. And next is the maternal factors that it can affect. First thing is that you might have heard that if by increase in age, that means after 30 years, there is a chance of a baby becoming with low IQ, or they might have some problems. So before 30, the baby, you should have your first pregnancy. That is what I ideally say, 30 to 35, before 35 years. So women's age and the number of children she had before may interact in influencing the development of the fetus. Okay. And women who have their first child when they are under 15 or over 35 are likely to experience more problem during pregnancy. You can now see many rape cases and all before 15 years. So if that girl becomes pregnant, that time there will be more complications during the delivery of the woman, because she's such a small kid. And if it is more than 35 also, if it's your first delivery, there are more chances of complications that can happen because our age increased. Okay. And diseases caused during pregnancy can, okay. If we get to have any diseases, that can also affect the developing fetus at that time. And the last thing is the emotional stress. That is the most important thing. If we are happy, that is the most important thing. If we cry, that will affect the baby. If we are, any kind of irritability, that can affect the baby. So our mental status is a very important thing in the developing baby. Okay. And that can even cause cardiovascular diseases and diabetes. That is what studies say. Okay. Now next. So, and the important thing is, if we have any kind of emotional stress, we won't eat food, but the fetus only depends upon the mother's nourishment, what we eat. So that is very important. Severe malnutrition can cause serious damage to this. If we won't eat anything, baby won't get food. So what happens is that the brain development causes, and there will be many complications, and can also cause other organs like livers, kidneys, pancreas, etc. Okay. Yeah, thank you. And I think at least.
Yes,
Thank you so much, ma'am.
Thank you.
Just a doubt, ma'am. You have mentioned about that endosulfan case, no?
Yeah.
So that abnormalities, can't we know it in the scan and all, ma'am?
No, actually, as I've told earlier, it goes on like generations. So they are prone to that. It can be identified, but their situation is very bad. Anyhow, they'll keep on, they won't, I don't think they'll go for such kind of anomaly scans and all. That, because that is a village that happened. In nowadays, it can, if we go for such kind of, by the 3rd month itself, sometimes we can identify such kind of problems. Big head babies. I think My classes, but I don't know how much you understand because it's just like a story.
Yes, ma'am. It
Wow,
was
it's
really
a-
useful that we have already discussed many things. So I hope they will be getting, and many of them are mothers also. So they
Yeah,
will
that
be
is what.
having the
Yeah.
experience.
Yeah, if you're a mother, I think you'll get to know about all such kind of.
And we are having a pregnant woman also, Diana, ma'am, in our class.
Great, great.
Yeah, I'm carrying, ma'am. 7 months completed.
Okay. So I think we'll
And-
just wind up.
Ah.
Thank you.
Sita ma'am and team, please.
Yeah, ma'am.
Yes.
Deepa, ma'am.
Ma'am, thank you so much, ma'am. Small appreciation from our side, ma'am. Super awesome, 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 super awesome. Oh, thank you, Methiha ma'am. Thank you, super Methiha ma'am. Thank you, super. Thank you, thank you, thank you so much, ma'am.
Thank you so much, ma'am.
Thank you, Deba ma'am. Yes, please.
Over to Bashrina, ma'am, for vote of thanks, ma'am.
Yes, ma'am. Good afternoon, all. I am glad to be standing here to express my vote of thanks. A special thanks to our chief guest, Dr. Methiha ma'am, for accepting our invitation. And you also present a valuable information for us about our stages of prenatal development and the environmental influence on prenatal development. I think we all understood it well, and it get many valuable information to us. And I would like to thanks to our Rahmat ma'am also, and my all dear friends too.
Special
That's all.
thanks to Tansi ma'am who have called our guest
ma'am.
and she have arranged.
Yeah, and
thank you,
I'm
ma'am.
really sorry for sparing your 2 days because I was in such a kind of.
No problem, ma'am. We can
all our
understand that.
mothers. Yeah.
We can
We
understand.
understand, ma'am.